we want is to move our patients from insulin resistant to insulin sensitive. We want that insulin that their pancreas is working so hard to produce to work for them. Now, I stop multiple times during this to ensure that my patients are following me. I ask them, are they following me? Are they keeping up? And ask them to reiterate some of the things that I have said to ensure they're understanding. Surprisingly, most of them understand and pick it up really fast. Then, once I've gotten them to understand the concept of insulin resistance, I ask them, how do you think you can move yourself from insulin resistant to insulin sensitive? Their answers will vary. This helps you gauge their level of understanding. Most of them will say weight loss. Some of them will say, I don't know. Some of them will say diet. But knowing their answer keeps them engaged and also helps you understand where they are. Then I move on to help them understand how we can make specific interventions to move them from insulin resistant to insulin sensitive. At this point, we've got buy-in. This is great. The patients are listening and they're empowered because there are things that they can do and they know why they're doing them. First, I talk about diet. This is not eat less. This is not reduce your calories. This is specific interventions targeted at insulin resistance. I recommend that my patients try to move toward a whole food plant-based diet. Now remember, this is not a dogmatic approach to nutrition. This is about meeting the patient where they are and helping them progress to the next steps. It's about changing the composition of their plate without changing everything they know. Food is very, very emotional, it's cultural. People have different perspectives and viewpoints about food. This is not about telling them they're bad, this is about empowering them to better health. So, first I talk to them about what the word whole means. Well, whole means limiting the amount of processing of your food. So, for example, I tell them, think about an apple. A farmer grows their apple on an orchard, washes it, sends it on a truck to a grocery store, it gets cleaned, you buy it, you eat the apple. Pretty straightforward. Then I tell them, think about Apple Jack cereal. How did that get from the farm to your table? And they all laugh because we have no idea, right? It's highly processed. When a food is processed, a lot of sugar, fat, salt, and additives are added to the foods, and a lot of the nutritional value is removed. So limiting the processing and sticking to the produce section or eating frozen or canned vegetables, so long as there's not additives, depending on what the patient's resources are much healthier food. Next, I talk to them about what a whole grain is, because most of them don't know. So a whole grain is something like brown rice that hasn't been processed into white rice. When we process a grain, we remove pretty much all of the nutritional value and fiber and just leave the starchy endosperm that skyrockets blood sugars and doesn't make patients feel full. Now, when we have a whole grain, there's fiber in it that makes patients feel full on fewer calories, and it also lowers blood sugar and blood cholesterol. So we can ask patients to replace some of the grains that they're used to with the whole grain counterpart. Next, fruit is on the table for my patients with diabetes. Bananas are on the table. If patients say that their blood sugar always rises with bananas, I may suggest that they try lower glycemic index fruits like berries. However, they need to look at the entire composition of the meal. For example, if a patient is eating bananas with bacon and eggs for breakfast, their blood sugar may rise and stay high because of the fat in their meal. It's not necessarily the banana's fault. Fat causes insulin resistance. Next, veggies. Veggies are all on the table. I ask my patients to focus on non-starchy vegetables. However, potatoes and sweet potatoes are still on the menu for patients with diabetes. As they become more insulin sensitive, they will be able to tolerate these sugars that are natural better. So if we focus on insulin sensitivity, patients will be able to tolerate more foods that they love. We do not want patients to feel highly restrictive. That plays into diet culture, and it can make patients have low self-esteem and feel defeated. We want to empower them and allow them to eat a wide variety of healthful foods that they can be excited about. And lastly, legumes, beans and lentils. These are some of the healthiest foods in the world. They are filled with fiber, they have protein, and they can be made in multiple ways. So I encourage my patients to make beans and lentils a large part of their diet. We have studies showing that patients who have a high composition of beans and lentils in their diet have reduced risk from diabetes. Next, we talk about exercise. So remember the muscle cells that we talked about that become insulin resistant? Well, exercise makes those cells more sensitive to insulin immediately after being performed, and improved insulin sensitivity from exercise can last up to 24 hours after the exercise was performed. Exercise is important for insulin sensitivity. We also have cardiovascular benefits from exercise. I encourage my patients to include activity in their day-to-day life and also to exercise as much as they can without getting injured. Patients often ask for specific recommendations on how much they need, but this is not a general recommendation. We have to work with our patients to see where they are, to get them moving more than they were yesterday. This is about progress, it's not about perfection, and every patient starts from a different place. Next, we talk about sleep. Sleep is highly, highly important for diabetes management. Of course, when we're not sleeping, we don't make good decisions. And patients who aren't sleeping will not be able to make good decisions about food and exercise. And more directly, when patients aren't sleeping, their cortisol rises. And with a high cortisol comes high sugar. If we tell a patient to fix their diet and exercise and they're not sleeping, our dietary and lifestyle recommendations will fall flat on their face. So we need to fix the sleep first. Next, I talk about stress with my patients. Many patients have highly stressful lives, and stress, like sleep, can cause variations in cortisol and decision making. Somebody who's really stressed is going to have a lot of difficulty making good choices about food and exercise, and stress also leads to higher levels of cortisol, which can increase blood sugar. There are some helpful ways to manage stress that we can recommend to our patients. Exercise is one, sleep is another, and also we have mindfulness apps, meditations, all kinds of resources to help our patients manage their stress better. More importantly, it is important to identify, recognize, and validate their stressors. Lastly, we talk about medications. There are some medications that can directly impact insulin resistance. For example, metformin works directly on insulin resistance at the liver. GLP-1 receptor agonists facilitate weight loss and thereby reduce insulin resistance. SGLT2 inhibitors also have modest amount of weight loss associated with them, and thus they may improve insulin resistance as well.
Insulin resistance can be decreased with a plant-based diet that limits processed foods, limits saturated fats that primarily come from meat, dairy, and eggs, and also avoids added sugars. A plant-based diet looks different for different people. You do not have to be a vegan or vegetarian to have a plant-based lifestyle. It is plant-based, not plants only or plant perfect. The Mediterranean diet is a plant-based diet. Exercise, good sleep, and stress management can also improve insulin sensitivity. In addition to lifestyle, some medications can also help with insulin sensitivity. The most common medications we use to target insulin resistance are metformin and GLP-1 receptor agonists, which facilitate weight loss, thus improving insulin sensitivity.